Okay, so today I'm doing a book review of The Infection Game, Life is an Arms Race by Dr. Sarah Myhill and Craig Robinson. And this, I believe, is her third book. I hope I'm right with that, but I've read both her books, the one on mitochondria. It's not hypochondria, it's mitochondria, I think it's called. It's about CFSME, which is my specialism. And also one called Sustainable Medicine, which was really very, very good. And I was drawn to this one because it felt rather prescient given the times we're in with COVID-19, that she's looking at the infectious basis of disease. And she's not just looking at the common infectious diseases like tuberculosis, for instance, but she's looking at more of the chronic diseases, which she specializes in. Now, Dr. Sarah Myhill is quite well known in the UK. She may not be as well known in the US or elsewhere, but she's a former GP, now the president, I believe, of the Society of Ecological Medicine, which looks at lifestyle interventions to help heal people from chronic illness. And this is a very interesting book. It's written in a slightly unusual way. It's quite stylized. It's obviously based on chess. I guess maybe Craig is interested in chess or something. And even the layout is sort of all blocks and tables, and it's got little asides which are written by him, on philosophy and history and all sorts of interesting little interludes. I actually found them a bit annoying after a while, because I'm more interested in the data and the understanding of disease. But anyway, I think it's a really interesting book. It has lots of brilliant information about the underlying causes of chronic disease. And I just wanted to quote you what she says on page 39, which is about the likelihood of a pandemic. This was written in 2018, bear that in mind. And she said, when this will come and what form it will take is not known, but come it will. And I think bang on there, she's absolutely right. And she believes it's driven by several things. Number one, the reduction in our natural immunity, which is coming through from poor diet, intensive farming, which is not only contributing to poor diet, but it's also contributing to increasing diseases because it sort of pushes viruses and bacteria to evolve faster into forms that we're not used to fighting, so into novel forms. And we definitely have seen that with COVID. And also EMFs, so electromagnetic frequencies, which are increasing. You know, everybody has a mobile phone, it seems now. You still see people with their phone clamped to their ear when they're taking calls. It's very dangerous. It goes straight into the brain. It's quite high frequency, and with the new range of electromagnetic frequencies about to come out, it's going to get even higher in the sort of 2 to 5 gigahertz range. Now, these are microwave radiation frequencies, and they interact with the brain, absolutely, definitely. So, you know, there are a number of factors here, and lack of sleep is another one. We're all getting a lot less sleep than we need, and we're getting poorer quality sleep than we need. But anyway, dealing in roughly in order of what she considers the problems are. Number one, diet. So her main premise is that we're all eating far too many processed carbohydrates. Now, I totally agree with that. And that they become very addictive, particularly as you age. So once you get into middle age and you find your natural energy delivery systems are starting to reduce, that's when we start to turn to the chocolate and the sweets and the carbohydrates to kind of boost our energy systems and give us a false sense of more energy. But these products are highly addictive, and they also create an unnatural balance in the body where we get what she calls the upper fermenting gut. Now, this is where you get too many starches trying to be digested in the stomach, which is really set up to digest protein. And so we get an imbalance. We get a lot of too much excess carbohydrates and glucose, which will give us symptoms. And here's the early warning signs that she mentions. So, and these are symptoms that we have an imbalance in our guts, and this is the first problem area for our immune system because it's the basis of our immune system is in the gut. So number one, plaque, so dental plaque. And you can test for dental plaque very easily. You can get a dissolving tablet on your tongue, which dyes it pink. But if your teeth feel slightly claggy when you run your tongue over them, they should feel smooth. That's a good sign you have dental plaque. Burping or belching and reflux disease, very important symptom that the stomach isn't acidic enough because of this excess carbohydrate environment, and you're getting the wrong kind of microbes, and it's actually coming back up the esophagus, and you're getting that kind of reflux or burping. It also leads to more dental plaque, particularly on the back of the incisors. Now, I didn't know that. That was new information to me, that's the worst place for plaque, is on the lower back of your incisors, because that's the closest to your esophagus. Makes sense, doesn't it? Body odor. And this is, an unmentionable thing, but we all know people who have body odor. Maybe we've had it ourselves. I would say I'm definitely in that category. I don't now because I've changed my diet completely. And it's basically microbes feeding on the sugars, which are excess to our needs. And so they're coming out on the skin, and particularly under our arms and in the groin area as well. And you tend to get the fermentation of those sugars. And when you get the fermentation, that's when you get the smell. Yeast infections. So things like, yeast on your nails, fingernails, toenails, athlete's foot, and some actually not just skin infections, but internal infections as well can be yeast driven. Joint and muscle aches, because you're starting to get infections in scar tissue in your joints and muscles. And that can eventually actually lead to rheumatoid or osteoarthritis as well. And one thing I would also add in there is fatigue, chronic fatigue related syndromes and long COVID style fatigue syndromes. So they are the longer term result of this chronic imbalance in the gut flora and low immunity. Quality sleep is really important. What do we mean by quality? We don't just mean the number of hours, we mean how your sleep cycles. Now, most people don't know that when you're asleep, your brain goes through a number of cycles of dream sleep and non-dream sleep. And it's the balance of those two, because dream sleep is all about the brain and resolving information and sort of filing stuff away and getting rid of stuff that you don't need. And non-dream sleep is when your brain actually shrinks and detoxifies and drains into your lymph system, and your liver starts to clear out, and basically products are got rid of from your system. So it's the balance of those two styles of sleep, and you should go through 3 to 5 cycles a night, and you need a certain length of time for that to happen well, and you need darkness, and that's not happening for most people. We're living in far too much unnatural light, and we use blue screens at night before we go to bed, and we're not protecting ourselves, and this really affects the sleep wake cycle, and it affects our hormones. So here we go. Anyone who's run down, so looking at stress now, run down, stressed, starved. And what she means by that is you're not getting the right micronutrients, because not only are you eating too many carbs, but you're also eating foods that are depleted. They don't have the vitamins and minerals in that they did maybe 40 or 50 years ago. And hence we're back to the soil, really. What's happening in intensive farming is the soil is being depleted. And you can't incorporate that into foods if you don't have it in the soil to start with. Being overworked or overtired, you become more at risk of long-term infections. And what happens is that the immune system is very energy hungry. It needs a lot of energy. And as I've already intimated, if your energy systems start to run down, your immune system is one of the first to go. Digestion is another, and cognition eventually as well. So you start to get slow, brain foggy. It's difficult to concentrate. You need loads of coffee to keep going. These are really important signs that something is wrong. She talks a lot about energy delivery, and I thought this was a really, really nice analogy where she uses a car to symbolize the human body. And here she's saying the fuel is basically fat and fiber. That's what we're designed to work on. These convert in the body to ketones, and it's the basis of her diet, which is she calls the paleo ketogenic diet, or the PK diet. The engine of the body is mitochondria. These are little organelles that exist in our cells which produce energy. The accelerator is our thyroid gland, and that's situated sort of roughly near the voice box. And the gearbox is the adrenal glands, and the adrenal glands are situated above the kidneys. So, and they help deliver the right amount of energy at the right time. So they kind of signal to the thyroid when it needs to pump out some more thyroid hormone. And servicing, I thought this was great, is obviously sleep. You know, we need this good quality sleep in order to clean out the debris. And that's exactly what sleep does. So she also suggests checking your core temperature. And I think that's something that I do with my clients, is get them to very simply use a normal digital thermometer. Oral is okay, or under the arm. Oral is more accurate. And your core temperature should be around 37 degrees centigrade. Sorry, I don't know what that is in Fahrenheit. You'll have to convert. Plus or minus about 3 degrees. And I meet so many people, so women particularly, who are running really, really low. A client came to me the other day and her average is about 35.45. All right, that is really low for functioning. It's almost impossible for the body to do a good job. And that's largely down to, you know, you're running on empty. You've got no micronutrients. Your thyroid is struggling. It can actually, your thyroid can be blocked with bromides, which come from chocolate and fire retardants on sofas, carpets, curtains, that sort of thing. Also, and swimming, going to chlorinated pools and bathing in chlorinated water. Also, your gut microbiome, which is really important. It's the microbes that live in and on you, which are entirely unique to the human. Each person has a slightly different microbiome. And in fact, different parts of you have a different form of microbiome. So Sarah actually talks about that the microbiome on your incisor teeth are different from those on your molars, you know, one to the next. I thought that was really interesting, and I've written a book on the microbiome, and I didn't know that. So, and where do we get these gut microbes? Well, we are inoculated normally through birth and breastfeeding from our mother, and then ongoing from the soil, on our foods generally, or contact with the soil, and fermented foods, which in many cultures are used as part of the normal diet. But the Western diet, the standard American diet, is sometimes called the SAD diet, or the Western diet, is almost entirely devoid of fermented foods. Now, fermentation is where microbes are deliberately encouraged to help digest the foods. Things like yogurt. Yogurt is a fermented food. It's not the one I would recommend here because we already eat far too much dairy. But things like sauerkraut, miso, kombucha, these are all fermented foods that are perhaps missing from our diets, which help to encourage a better balance of microbes in our gut flora. So we're missing that. And then she goes on to talk in a lot of detail about different chronic diseases that have viral or microbial infectious agents associated with them. And some of them you wouldn't be surprised. You know, I've already mentioned tuberculosis as an example, and, you know, cholera and diphtheria and things like that, measles, mumps, all having very well-known microbial components. But less well-known, I would say, dementia. Dementia is an absolute pandemic, driven in large part by things like Borrelia, which is linked to Lyme disease, herpes viruses, and mycoplasma toxins. Mycoplasma is a form of fungus that we pick up, unfortunately. We get it from various sources, but it's getting more and more common, unfortunately, in the environments we live in, damp environments. And even chlamydia can contribute to dementia, the sexually transmitted disease. So breast cancer, I was very surprised to read about the HERV virus, and that's a form of retrovirus that's very highly associated with breast cancer. Now, I already knew that iodine was really, really helpful in preventing breast cancer, and I couldn't work out why. But if that's true, that there is a high infectious component to breast cancer, then that would make perfect sense, because iodine is actually very antimicrobial. And to pull that together, she sort of goes into a three-pronged approach to helping people overcome these conditions. And she calls them groundhog basic, groundhog acute, and groundhog chronic. Now, I don't quite know where the groundhog comes in. I only know the film, the Groundhog Day, where something keeps repeating over and over. So maybe it's something to do with that. But groundhog basic is your basic maintenance diet. And that, she concludes, is a high fat, high fiber, or PK, paleo ketogenic diet, which she does go into a little bit of detail, but there is more in the, she's done a cookbook as well, which has full recipes and so on, which she's converted over to very successfully and has tried to promote in all her clients, because we really need to get away from these high carb, high dairy, high gluten diets that we're all eating. And then there's a few additions. So, and these are the important ones for everyone to know. Okay, vitamin C, it's cheap, it's readily available, it's profoundly antiviral, and you should be taking additional vitamin C, because unlike many animals, I think it's only us, some primates, and guinea pigs who don't make vitamin C naturally. We have to have it in our food. And so you should all be taking vitamin C. She recommends you dissolving something like a salt, or you can go for the ascorbic acid, but an ascorbate, which is a salt. Usually I think it's magnesium ascorbate or sodium ascorbate, but just dissolving that in water. And I like to take it just before bedtime, and I found that works really well for me, because it helps to maintain this acidic stomach, the upper gut, which we need. We need an acid stomach to help digest proteins. And so number one is vitamin C, adding that to your diet at 3 to 5 grams a day to what's called bowel tolerance. What that means is until you get diarrhea. Okay, there's no problem. It just means that you're clearing out loads of stuff, loads of unwanted debris and microbes. And so it's actually a really good way of checking how deficient you are, and also how heavy your load of bacteria and viruses is, because the more you need, the higher your load. So 3 to 5 grams is a basic amount for everybody. And then iodine. Iodine is absolutely necessary. And we evolved around the coasts, around rivers and streams, where fish and seaweed were our basic diet, you know. So iodine was common. Most of us don't get enough now. As I've said already, most women are highly deficient, and men too. And you can actually buy iodine solution and put it in your medicine cabinet. Lugol's iodine is one that's recommended. Do a little skin test for yourself. A few drops in a square of skin, maybe on your upper arm, and just see how long it takes to lose that yellow color. Now, that should last for 24 hours if you are, you know, already having enough in your system, if you're not deficient. Now, for me, it lasts about an hour or two, which points out that I am deficient. So I'm gradually building up my iodine intake, but it's a great thing for your medicine cabinet. It's brilliant for any skin infection, anything really, anything that is bacterial or infected. I recently had a small procedure on my face where I had a little mole removed, and it got infected. Even though, you know, I was very, very careful, and I had it done in a sterile environment in hospital. The staph infections are so common there. I think that's probably what I had, but it started to get rather horrible. And at the last minute, I suddenly remembered I've got iodine in the cupboard, and I just put a couple of drops on, and within a day it had gone. And I'd been struggling with it for a few weeks. So iodine should be in your medicine cabinet along with vitamin C. What are the other things? Well, there are some additionals which are not necessarily products. The things like heat therapy, so things like saunas, light therapy, having infrared lights or lamps a home where you can actually bathe in good quality light, because a lot of us are light deficient as well, or we're getting the wrong kinds of light, too much blue. Exercise of the right kind, you know, not over exercising, but getting out into daylight and exercising 2 to 3 times a week at least, and once it should be, you know, you're making your heart work. And as I've said, this quality sleep with, you know, blackout, either wearing some sort of mask that helps to black out the street lights if you live in a city, or blackout curtains, very, very useful. And switching off EMFs at night as well. So not having your phone by your bed, your mobile by your bed, unplugging stuff, because it really does affect you, and particularly when you're sleeping. So that's groundhog basic. And that is enough to reverse a lot of long-term conditions. But what if you've got a sudden acute emergency situation? What would you add to that? Well, things like sunshine salt. Now, sunshine salt is a mixture of minerals and mineral salts plus vitamin D, because vitamin D is one of the most important antivirals, antibacterials, anti-cancer. Actually, it's profoundly anti-cancer vitamins. Well, it's not even a vitamin. It's been misnamed, unfortunately. It's a pro-hormone. We all need it. We normally get it from sunlight. But for those of us who live and work indoors, and a lot of us are much more indoors these days, and also in northern climates where the sun doesn't reach a high enough angle and the frequency of sunlight isn't great enough, and that's true in the UK between October and April, that we don't make vitamin D even if we do get out, because we simply don't have the amount of the right kind of frequency of sunlight. So vitamin D deficiency is endemic, absolutely endemic. Most of us are deficient, particularly if we're dark skinned. And so adding vitamin D to your routine, to your supplemental intake, is really, really vital. Take it with K2. There's a lovely combination. They help each other. Fasting, actually not eating for 12 hours a day, at least. Your eating window should be something like 10 to 12 hours, and the fasting window should be the rest of the time. Constant snacking is one of the biggest drivers of this kind of dysbiosis, as we call it, the imbalance of your gut flora. We're designed to go to sleep when it gets dark and get up when it gets light, and eat during daylight hours. And a lot of us, due to complete 24-hour availability of food, are not doing that. Other things she suggests adding to this mixture for acute infectious issues are glutathione. Now, glutathione is one of the most important antioxidants in the body. And so it helps to mop up excess, what they call free radicals or oxygen species. And these are part of the immune system's initial defense against invaders, but it can overfire, if you like. Friendly fire starts to destroy our own tissues. This is the basis of autoimmunity. So getting some more glutathione into the system. Again, I tend to take mine at night, not at night, just before I go to bed. And again, building up slowly, and maybe having a few days off in the week. So you don't do it every day, but you certainly boost your system. Coenzyme Q10, very important for energy delivery. And again, that can be taken as a supplement. Detoxing from time to time, giving your body, particularly your liver, a break, allowing your liver to cleanse and clear itself out. It normally does this at night during the hours roughly 3 a.m. to 5 a.m. But with a clogged liver, this is one of the reasons why viruses and bacteria are not being cleared out of the body. And so we're getting this cytokine storm that you've all heard about. People who are suffering these kinds of overreactions to a virus are likely very clogged. They're stressed, they're not eating well, they're not sleeping well, and this is the result. The virus is not causing this. This is the body's over response. And so getting a detox, or a couple of days in the week where you don't eat so much, or even better, going for a day without food. I mean, that's something that most people wouldn't even consider, but it's what you do naturally when you have a cold or flu, isn't it? You just stop eating. That's because your liver needs that extra energy devoted solely to clearing out the pathogen. And then Dr. Myhill actually talks about taking thyroid glandulars. Now, these are ground up glands from animals. So vegans, I'm afraid there isn't at the moment a suitable alternative, but they are profoundly important if you have autoimmune thyroiditis, which is a very, very common problem with a lot of people. Remember, I said if your body temperature is low, it's likely you're running without enough thyroid hormone. And so adding in a glandular actually boosts your own thyroid until it's ready to take over. And you can add in adrenal glandulars as well if it's a really big problem. And finally, groundhog chronic. Now, this is for people who have really had these issues for a number of years and their systems are so run down. They've got multiple infections, things like Lyme, EBV, which is Epstein-Barr virus, which is, again, really, really common. About 80 to 90% of people have had it at some point in their life, sometimes called glandular fever in the UK. Now, for these people, their systems are so depleted. We've got to start with all the previous, so the PK diet, the vitamin C, the iodine, the sunshine salt, exercise, sleep, and so on. But we've got to add in certain extra arms, so things like herbals, and she recommends astragalus, cordyceps, which is a mushroom, and rhodiola, which is a herb. She also adds in other things like D-ribose, which is a sugar, but it helps. I think it helps the kidneys particularly. And reviewing your medication, like what medication you're on, because medications can often drive these issues because they don't treat the source, they just treat the symptom. So people can end up on multiple medications which are driving inflammation in the body and actually making things worse. Now, this is an ex-GP saying this, so just remember, she knows what she's talking about. Things like the pill, a contraceptive pill, proton pump inhibitors. She goes into a long, long list, but very common drugs, statins, all drive certain reductions in immunity, which make us more prone to infectious and long-term chronic health conditions. Great business model for certain people who shall remain nameless, but not for us. Okay, so reviewing your medications, what do you actually need? Are you on the right doses? This can all be done in combination with your doctor, and should be done in combination with your doctor, but we really need to get educated. Yeah, and finally, antibiotics, which she recognizes may not be agreeable to everybody in natural medicine, but she finds are necessary from time to time. And being someone who can prescribe, she often does. So if you've got really intractable conditions like Lyme, for instance, which, are very severe diseases, sometimes masquerading as ME or CFS, but they're actually driven by Lyme, then you may need courses of antibiotics. And the main thing is that you use different types. So you kind of hit them in different ways. So it's sort of adding into the effectiveness. So overall, I thought this was a really interesting book. When I got over the slightly annoying style of these interludes, if you like, I did think it was very worth reading, and it's something that took me quite a while. It was very dense, lots of information in there. She's very good because she includes all the references, as do I, in all my books as well, because I want people to understand that this is researched. This is not somebody's ideas that don't have a basis in research. Well, I just want to read you from the postscript, just to end. Western medicine has lost its way. Doctors no longer look for the underlying causes of disease, a process which used to be called diagnosis, but rather seek a quick fix response that will see the patient out of their surgery door in under 10 minutes. This quick fix response usually comprises the prescribing of symptom-suppressing medications. Doctors have become the puppets of Big Pharma, dishing out drugs and working to a checklist culture which is directed at the symptom rather than the patient. Patients are seen as a collection of walking symptoms rather than as people each with a highly individual set of circumstances. Worse than this, not only do these prescription drugs do nothing to address the root cause of illness, but often they accelerate the underlying pathology, and so drug prescribing snowballs. Yeah, I won't go on, but you can see her basis, and she has actually had to fight to stay working because, you know, the powers of regulatory bodies to shut people down who speak out about the way we're going, about the current medical model, is huge. And even me talking about this is likely to get some form of retribution, I expect. But I try and keep my approach very balanced. And all I'm saying is this deserves understanding and recognition. And this is the way I and my colleagues work. And I'd really encourage you to read this book. I'd really encourage you to read around the subject and to get informed and empowered about your own health, because you can change your outcome and your lifestyle. It is perfectly doable. Understand your enemy, she says. And I think the enemy is out there, but it isn't coronavirus. It's actually our poor immune systems. Thanks for listening. Look forward to hearing your comments.